Secondly, about the question about the 18% GST on health policies. This GST should be abolished as early as possible. Provision of updated machinery and equipments and major improvements in other facilities are needed, and those improvements should be done immediately. Considering the number of devotees participating in the Kumbh Mela, there is a need to take massive steps at the government level in terms of public health.
माननीय सदस्य श्री राजाभाऊ वाजे जी.
Honorable Speaker, Madam, I thank you for the permission and opportunity given to me to speak in this August House on the demands for grants under the control of the Ministry of Health and Family Welfare for 2024-25. Madam Speaker, the constructions of hospitals and necessary infrastructure is being done on a war footing, as the government says. But what about the doctors and the trained nurses in the rural and tribal areas? The government is requested through you, Madam, to look into the necessities and technicalities in this field. Secondly, about the question about the 18% GST on health policies. This GST should be abolished as early as possible. Shortly, on the basis of some important points, I would like to draw the attention of the Minister and the House regarding public health services in my constituency, that is Nasik. First point, regional referral hospital Nasik should be taken over under NHM and NCD. Government scheme and necessary funds should be provided for the new machinery and free treatments to benefit the patients who have exhausted their expenses under various government schemes. There should be a provision of updated machinery and equipments, and major improvements in other facilities are needed, and those improvements should be done immediately. Nasik Kumbh Mela 26-27 will be organized in my Lok Sabha constituency. Kumbh Mela is the largest religious and cultural human gathering in the world. A large number of sadhus, sadhvis, pilgrims participate in this fair. UNESCO has also included Kumbh Mela in the Intangible Cultural Heritage List in 2017. This government hospital in Nasik city is not upgraded and not enough to provide medical services. Considering the number of devotees participating in the Kumbh Mela, there is a need to take massive steps at the government level in terms of public health to ensure that they get immediate medical care. The third point, Madam, the management of ESIS hospitals, which serves a total of 2 to 3 lakhs workers who work in the industrial areas and their families, is very poor. The hospital should be run under the guidance of the Union Minister of Health and with proper coordination with the Ministry of Labour and Employment. Lastly, the tribal population still faces huge health challenges. Adequate funds should be made available after a relative analysis of the health system in Nasik and the tribal areas of Maharashtra. Thank you, Madam.
धन्यवाद माननीय सदस्य.